Well, I'm very pleased to be here today with Dr. Santanu Chatterjee. He is a physician in Kolkata, India, and he is in private practice and an academician. And he's also a consular resource for a number of international embassies and consulates throughout East India. So thank you, Dr. Chatterjee, for joining me today.
Thank you, Chris. It's been a pleasure. We touched base after a while, and we've been knocking into each other at various meetings and conferences.
Yeah,
It's
for a
nice
long
to talk
time
to
now.
you. A
Thank you.
long, long time, long time.
First question, in India, what are some of the more popular tourist attractions, and do any of these have particular health concerns that travelers should be aware of?
So the classic tourist destinations are the Golden Triangle, which is Delhi, Jaipur, and Udaipur, Jodhpur. So that's a triangle in northern India.
Mhm.
Then, of course, you have the west, southwest, southern India, which is like going into Goa and then trickling down into Kerala and going around Kerala and in on the boats and having a massage and that kind of a trip. Then you also have the temples. So if people are interested in that, you can start right from central India, go up to either north or south to traditional places. And so a lot of some tourists come on this kind of trip. And then on the other side in eastern India, where I'm based, you have people coming up from here, going up to the Himalayas. So going up to Darjeeling and Sikkim,
Mhm.
some going into Bhutan in the adjoining country. So they use eastern India as an access. And then, of course, the new destination is the Northeast,
Mhm.
where we have the sister states in Assam, Nagaland, and very very beautiful places, tourist facilities just coming up in those places. And in the olden times, it used to be off the beaten track, as we said, but now
Mhm.
it's becoming increasingly popular.
Mhm.
So you have all this.
Mhm.
And then you have the island tourism, which is a smaller extent in the Andaman Islands
Mhm.
for a short while. So you have a mix of stuff in India. Northern India, classically, most people usually visit during the winter time, so between November and February,
Mhm.
March. And you remember that, for November in northern India, AQI levels are high. There are pollution issues because of burning of crops. And post Diwali, which is right now, and a lot of people get into, if you're allergic, you have asthma, you have other situations, then people get into difficulties
Mhm.
given the high
Mhm.
AQI. Also, interestingly, if you see the trend in infectious disease, there's a bit of dengue hanging around in October, November. And now this year we've had chikungunya, which is just now going out.
Mhm.
But around October, September, August, we had chikungunya outbreaks, focal outbreaks in the country. So yeah, with season, with place and time. Remember that the monsoon, which is really between about June, July to about October, September, October, that's the months where it's rainy, muggy, weather is bad, especially in northern India.
Mhm.
And most of the mosquito-borne diseases, which are commonly associated in our scenario, are pretty prevalent there.
Mhm.
So also
Okay.
influenza is pretty prevalent, not in the winter months, but mostly post pre-monsoon months,
Okay.
especially in the central part of India. There is some difference in southern India and in the northern tip, but mostly, generally speaking, that's the time.
So it sounds like things like insect repellents are more important in the monsoon season than
Absolutely. I mean,
in the
if it's the
dry
only
season.
thing you need to carry, I think it's insect repellents are I think, of top of my list. And the second thing top on my list is, of course, a pre-exposure rabies vaccination. I
Okay.
think this is the two top things you need to do before you get on a plane to India,
Good.
in
Okay.
my
Good.
opinion.
Good advice. Now, you've been interested in travel medicine for many decades. I've been seeing you at
Yeah.
meetings for many decades. What was it that
Yeah.
first prompted your interest in travel and tropical?
Yeah, I was thinking about that, Chris, actually, when you asked me, and it was very interesting. I graduated in the mid 80s out of medical school with a specialization in tropical medicine. And was thinking of doing practice, some hospital attachments. When about I think around the just around 1989, 90, I had been called in to see this young girl who was a volunteer, American girl, had high fever, was actually working in an NGO in the periphery of Calcutta, about 100 miles or
Mm,
so off,
mm,
and had fever, had taken some Panadols, and then she started vomiting and really collapsed. So they brought her in and they asked, so somehow my name was referred. And then I walked in to see this young girl, absolutely flushed with low GC general condition, high fever. Well, to cut it short, it turned out to be falciparum malaria. And then, of course, it was touch and go, but we got her out of it. She went back home smiling
mm,
in about 3 weeks. But what struck me very interestingly, and I'd asked her, and this was right in July, August, which was our peak malaria time at that time. And I asked her, I said, why didn't you carry some prophylaxis or, use repellents? And she said, she was told by her friends in wherever, I don't remember that, but that if you take these tablets, they are toxic and they cause much more harm than good. So this kind of struck in my mind. And the other thing, which probably was more interesting, was a personal anecdote where I had relatives from abroad who would come annually to India, and one particular lady, she would every time we all ate together with a family lunch. And the joke was that what happened to her the next day morning. So every year. So what struck me was we all ate the same food, we drank the same water. Why is it that she had so many episodes or a few episodes, depending of diarrhea the next day? What really was happening? And we were treating her like locals. So in the meantime, I was looking at some BMJ articles and I came in touch with this new thing called Travelers and Their Health, which came out from Glasgow,
mm.
from Eric Walker and the team. And so in those days, we didn't have mobile phones and we didn't have emails, right?
Right,
So
right.
we got in touch. I think email to us came a little later around, just a little later, because I remember 1996 was Hotmail, yeah? Times have changed. Huh? 204 was Gmail. Yeah.
Right,
So things
right.
have just gone in a leaps and bounds. And we didn't have mobile phones. So we actually in Calcutta had the first mobile phones in India. And I
Mm,
remember it was in 1995 with a company which used to be called some Modi Telstra and then became Vodafone. And I was given this a very heavy Nokia phone, which you could throw at a person and it would still work. So I still remember that. And this was this gadget in our hands, which was very interesting. Anyway, so we were treating them the same. So I got in touch with Eric Walker. And then over time, I was asked to, we heard of this travel medicine conference. And this was the second conference in 1993, I think, ISTM in Paris, where I came to listen and a whole new world opened. I
mhm,
came in touch
mhm,
with Robert Steffen and with Bert
mhm,
Dupont from CDC,
mhm.
the Mefloquine person. Bert was very, very encouraging, and Robert. And they got me to the next conference in Acapulco, where I presented a paper on compliance of malaria anti-prophylaxis in India. This was a poster done after that incident with the lady, which
Got it.
got me thinking, why do they stop anti-malarials when they're traveling? So that was interesting. Good old days. We had lots of fun. Since then, we've attended most of the international conferences. Look forward to the next one in New Orleans, and made some wonderful friends, and learned a lot of science. So
Nice.
that's how
So
it
it
all
sounds like
began.
you've been with travel medicine really since the field began to
Absolutely.
form as a
Yeah, I
field.
was the first person in South Asia when they gave me the fellowship, the
Oh, nice.
first person in South Asia to be given that and to be acknowledged internationally. Yeah.
Nice. Well, you
Anyway.
mentioned the American woman with malaria. What are some other travel-related illnesses that you see in your practice?
Well, interesting you said that. I have seen the whole gamut, yeah. I mean, of patients, given my various inputs over time. Now I see a little less, and I'll tell you why. I get more telephone consults because of the mobile. The mobile has
Mm,
revolutionized and changed our practice and also changed our practice of travel medicine. So, but be that as it may, I've seen mostly commonest in the older days times. It was like malarias, the dengue,
Mhm.
the bites. Especially, I have had dog bites on and off. Even
Mhm.
this year, I've had a couple,
Mhm.
or I mean, three of them, I think, in fact, on travelers. I have had many in local population, but in travelers. So from that to things like which are not core travel medicine, but I think it's important, psychiatric patients. I've had young psychiatric patients who left their medications, went to
Mhm.
a meditation clinic, got into an acute psychotic attack. And I worked a lot with volunteers here, with the Mother Teresa's in the olden days, where I did a few papers, and that got me in touch with this community who stayed for a long time. And there were various things for long-term travelers. We always thought about short-term travelers, but these we followed them over periods of time. And then Robert and I and some of our colleagues got together to do this very seminal paper. This was the first paper from India. They were very interested in those days because nobody had data from India. Everybody talked about the American students going to Mexico and the
Mhm.
soldiers going to Vietnam or wherever. But there was a big chunk in India which was, missing. What was the rates of travelers' diarrhea? What was happening? And so we did this seminal study in Goa and in Calcutta, and this got published in the Lancet. And then, of course, we had a few trials with medications and stuff like that. But I've seen the whole gamut, from acute coronary attacks, as
Mhm.
I said. So not just core travel medicine, but anything from trying to, we have to be a jack of all trades. You get a call, you have to fix a dentist on a Saturday. Someone's cap has come loose, or we fortunately in India, as in this part of the world, we can get access to specialist care reasonably well, even on weekends to some extent. So and it's mostly walk-in. So we are able to organize it. But the main thing for me was organizing it. Then on the other side, I have had this very interesting, this American lady, which is very, very interesting. And I read about it later. The first time it happened to me, she landed in India alone, a widower, about, I don't remember, late 60s, early 70s. She wanted to do social work. There was no one back home. She got inspired by this story in her church meeting, and she landed up in the hotel, and she just couldn't get out because the sight, the sound, the noise, the people, the environment was complete. She was just in shock. She couldn't get out of her hotel room. I mean,
Mhm.
I've never, people talk sometimes about it, but I've gone through this process. And so it was a long time trying to help her, and really for me to understand that, how you guys do pre-travel, how important pre-travel is.
Mhm.
And this was
Mhm.
about in the mid 1900, maybe 1995, 6, around that time. How
Mhm.
good and essential is pre-travel? Prepare, even if it's a single visit, how to make sure that the person at least also has a little idea of the country he's visiting. It's not going to Mexico or for a holiday or the Caribbean on a cruise. India, as I always say, is an experience. It's never, just a holiday. It's a destination of sorts. It's an experience. So I think mentally also we talk less about it. Mentally we need to be prepared a lot, and so I've seen that also. So
Okay.
fairly, that I call it, my travel medicine is my passion, and my clinical practice travel is my tropical medicine is my run of the, my journal talk. So that keeps me interesting because you meet very interesting people, and over the years, and yeah,
Okay.
so that's how
Good.
it is.
Well, that ties into my next question. Suppose somebody's in India and they need medical care. What's the best way for a foreigner to access medical care?
All right. Now, look, if you asked me this question in the mid 1995s, I would have given you a total different answer. We didn't have the mobile phone, as I said,
Mm.
that we didn't have
Mm.
internet access. So I think what's happened is the internet and the mobile has made things much more easier.
Mm.
At the same time, the traveler sometimes being sick and accessing healthcare is faced with a plethora of information. And how does he process this information? How does he understand which hospital is good for him?
Mhm.
Because in the Google, anything can show up, right? So I think there is always this side of the story. But of course, having the mobile, having the communication aid with you, you can talk back to your doctor back home or to the clinic back home. That gives a lot of confidence to the
Mhm.
traveler in front of me.
Mhm.
So access, two things I should say. Normally, if you're traveling to India, it's always nice to have a little list, if you know where you are going, of the preferred hospitals.
Mhm.
Secondly, if you look into US Embassy website, for example, they'll give you the preferred hospitals and doctors of a particular destination. Maybe not exactly yours, but most of the main cities are covered. So it might be worthwhile just having a little look at that and being prepared in case something happens. Then the third option is, of course, where you are staying, they will probably know the nearest hospital.
Mm.
Not a excellent not an excellent choice, but it does work sometimes.
Okay.
Even word of mouth. See, for us, we don't advertise, but I get patients coming from word of mouth. So that's the
Okay.
last. And the last one I think is important is um, if you walk into a corporate hospital in India, and you say you are an international patient, you obviously have insurance with you. So there's always this international desk within inverted commas,
Okay.
or a person dealing with, but mostly this person actually is dedicated for medical tourism and not for the sick
Oh,
traveler.
oh,
But
oh.
it doesn't matter. It doesn't matter. You, you can go in there and you can access that, and that should be another interesting access for you.
Okay. Well,
So
good.
I think for the traveler now, they've got lot easier access. But of course, as I said, you need to do your homework.
Right. So take some names with you, do a little research,
Absolutely,
do
an
your homework in
hospital name, and
advance.
that's it.
Now, speaking of preparations in advance, you've mentioned a few things that you would recommend for travelers. Malaria prophylaxis when appropriate, insect repellent, particularly during monsoon season, immunization for rabies. Any other particular pre-travel
So let me
preparations
go
you would
back and
recommend?
revisit malaria. Malaria now, what we see in our local population, and we rarely see malaria in our travelers. Malaria has definitely come down from the 1990s. This is a fact. And now malarial advice for chemoprophylaxis is very focal and very targeted. Though
Mm,
the CDC says that you need anti-malarials, the Europeans are much more focused. And so if someone is taking a tablet, I don't say no, but if someone doesn't want to take it, we need to be exactly sure where they are traveling. So sometimes you can get away with it. The second is, I cannot but emphasize using adequate mosquito, repellents. And even I, when I travel, I have one in the car and one with
mm,
me,
mm,
just when in any case I will forget.
mm,
So that's most adequate. And doing it the proper way, and using it the proper time, what exactly is needed, what is for the clothes, what is for the skin. I frequently see people just spraying everything everywhere.
mm,
So simple things. Then the third thing is, which is very important, I think, when you come to India, is apart from rabies, if time allows, check on your hepatitis B and A titers. And
mm,
that's very
mm,
important, I think.
mm,
The second most. If you're envisaging traveling in buses and trains, might be worthwhile getting flu
mhm,
shots,
mhm,
because previously we didn't have much influenza data from India, and we thought it's not, it is very little in India. But once the government started to monitor influenza, we found that there's a lot of influenza actually also in India,
mm.
and most of it all the year round.
Oh,
It's
oh,
not
yeah,
just
yeah.
in the winter
Interesting.
season. And this has little peaks around monsoon. That's in central India. South India is slightly different. But generally, the flu is there around, hanging around for a while. So taking a flu shot, getting some protection, I think is excellent. It saves you some antibiotics or whatever, or some misdiagnosis somewhere. The other thing would be for, I my pet story is rabies, to be frank. And I always tell people, please, and now if it's even one shot, or it's two shots, I believe, which is now advocated. There are recent studies about one shot, which is off label. but take be very careful. You can never be sure. And previously people used to say avoid bites. How can you avoid bites? You're walking down the road. So travelers tell you a lot of things, and I learned from my travelers. So I remember this young backpacker who told me every time at night when he walked down, and he was a volunteer, he always carried a stick for the street dogs, and the street dogs avoided him like hell. So this was, just little
Yeah.
tricks. And another volunteer showed me how easy it was to actually tuck in the mosquito net, because people who are not used to sleeping under mosquito nets finds it awkward, maybe a
Mhm.
little suffocating. And
Mhm.
so they showed us a unique trick how to do it, how to feel comfortable. They've been traveling all over the country. So things like this, you always keep learning from your travelers. What about, when the first water purifier, the
Mhm.
pens came out, we
Mhm.
didn't have them in India, and I saw them from one of my travelers, and he said he uses that to travel, to get his water cleaned, be clean and potable.
Right.
So you always learn. I think that's very, very, very. If you talk to people, you learn um, lots of stuff.
Well, with travel medicine, with all of the countries in the world and all of the medical problems, you can never master it.
Yeah, I always tell people, I think you are constantly learning, and it's also a question of interaction, and it's a question of judgment.
Mm.
Sometimes I get called, okay, for someone, like, I wouldn't have given them a tab, like a diarrhea case. I wouldn't have given them an antibiotic. But then I asked them, where are you going next? Oh,
Mhm.
I'm going on a safari. And I said, well, maybe you should carry the tablets with you. Well,
Mm.
I mean, it would be dashed awkward if he's on a jeep watching tigers somewhere in the middle of central India and try, when he feels the urge to go to the toilet.
Right.
And forget that. He's put in a lot of money, effort, and time for this safari. And so in that case, maybe sometimes you have to err on the side of the,
Right. Right. Right.
yeah. Whereas if he was in a city, I would have said just watch it,
Right.
see how it goes, wait till tomorrow, day after. So it's also a question of this judgment which makes it interesting.
Well, now, final question. When you see people from India who are traveling as tourists or as business people, what are some of the most common places that you see people traveling from India to?
Yeah, that's very interesting. I mean, there's two groups. One is the tourist and one is the non-tourist. The non-tourists are people like the IT workers. They travel all over the world, mostly to North America, Europe,
Mhm.
Australia. The other group in non tourist are the what I call, which is a big segment, which people usually they don't get caught on the radar. Is the traveling? I call them the traveling grannies and grandpas. All most of them traveling to Canada, to America, Australia, New Zealand. These are the places where they're traveling to see the children,
Mm.
or sometimes doing nanny duty for the
Mm.
young born.
Mhm.
And some of them have never traveled abroad, and these are they're going to do a journey from India to let's say the east coast of America, with the halt, and they think everything outside is hunky dory for them, and they forget to control their little bit of edema, the incipient cardiac failure they have. They don't
Mm.
visit the doctor here, all these little things, or they
Mhm.
develop a cough, or they have something else. So that's one group which is not caught. Among tourists, you have the young millenniums who are traveling all over.
Mm.
Millenniums. So previously, we always traveled to Singapore or Thailand or Maldives or something. But now the young millenniums, they want to go all out. So to safaris in Kenya, to Azerbaijan and Armenia, and has become very popular. Central Asian states have become very popular. Wherever the airline from India flies in, you get this, there's this whole advertising spree after that, which
Mm.
pushes people for a week's holiday. So
Mm.
so it goes on up like that. And then of course you have the Commonwealth travelers going to England, to Paris, to European destinations. But those are like normal tourists anywhere. But what's not caught under the radar is this traveling grandpa and grandmothers who travel a lot.
Mhm. Mhm.
And yeah.
Interesting. Okay. Well, thank you so much. Well, I don't have more questions. I want to thank you for your time today. Dr.
Thank you.
Santanu Chatterjee is in Kolkata, India, and
Thank you.
all best. And thank you so much.
Thank you, Chris.